My name is Paula Vivili. I'm currently the Director for the Public Health Division here at the Pacific Community, SPC. I think in terms of magnitude, the answer for most, if not all, public health, certainly health people, would be no. To have a pandemic of this magnitude is a new experience for most, if not all, people. Certainly in the Pacific, this is the first time that we've had something of this magnitude. Certainly we've had some experience with epidemics in the region. We commonly have dengue epidemics, Zika. Samoa had a pretty bad outbreak last year with measles, but certainly with something that has impacted the whole of the Pacific, certainly the whole of the world now. We haven't had this experience before. In terms of coronavirus type illnesses, we have had experience with SARS, which fortunately did not get to the Pacific, as well as MERS, which is more recent, and again, fortunately, that didn't get to the Pacific as well. But now with COVID-19, it certainly has reached us. So in terms of magnitude, it's something that no one really has experienced before. If I give a couple of quick examples, in terms of COVID-19 testing, currently in the Pacific, only 5 countries are able to do testing. Fiji, French, Polynesia, Guam, New Caledonia, and Papua New Guinea. Of the 22 Pacific Island countries and territories, these are the countries with level 2 labs, and therefore have the capacity to now test for COVID-19. The rest of the countries, they currently cannot test in their own countries. This has implications, of course, in that we're trying to address this disease, but we're not able to test locally. Another example is this discussion about flattening the curve, where we talk about countries trying to extend the period where people are getting sick so that the health systems are better able to cope with it. They say if 100 people get COVID-19, about 80 will have mild symptoms, no problems. About 15 will have severe illness, and about 5 of them will have critical illness needing intensive care to be provided to them. For many of the Pacific Island countries and territories, their intensive care capacity may not be up to 5 at any one time. And so whereas in many other countries where we're hearing flattening that curve is a good discussion and makes sense for these countries, for the Pacific, just having the cases in the first instance is a very difficult thing to cope with in the first place. SPC has its areas where it's pretty good at having skills internally. We have good skills around health system strengthening, around the area of surveillance, around the area of lab strengthening, around clinical services and risk communications and communications in general. And so these are the specific areas where we provide. And so, for instance, when I talked about the lab services before, our team is involved in a small group of experts from the partners in trying to put together how best to help the countries. So, for example, what we are putting in place is we are hopeful that in the next 2 weeks or so, we'll be able to provide all the countries with the capacity to test for COVID-19 in country. And we hope to do this by using a machine that is already available in all the countries for testing TB, but the company that made the machine has been able to make cartridges to also test for COVID-19. Clinical services is another example I would be happy to talk about. As I mentioned earlier, a country's capacity to deal with cases in the clinical field is relatively limited. So again, SPC has a team of people who are working with other partners to see how many ventilators, for instance, the countries need, plus equipment and services around patient management, as well as assisting make available to countries standard operating procedures so that the people and staff in the countries are able to manage the patients better. It is worth saying that during this time, one of the very good things that has happened is that since the pandemic was declared, and before it was declared a pandemic, a joint incident management team was set up based at WHO Suva office. where all the partners who are involved in this response came together. In the incident management team, we have WHO as the lead agency. We have PIHOA from up north, Pacific Island Health Officers Association from the US affiliated states, SPC, as well as other UN partners, UNICEF, UNDP, OCHA, other partners, ADB, World Bank, and also our development partners, Australia DFAT, New Zealand MFAT, and French AFD, and more generally some support from EU. So all the partners, they quote anything a country needs that comes through any of the partners has to be channeled through to the IMT, and a master spreadsheet is put together to ensure that everybody's on the same page. This is what the countries are wanting, and it allows for a better coordinated response to them. Prior to the travel restrictions, we send teams to the countries. For SPC, for instance, before the travel restrictions, it was not uncommon that we had between 5 and 10 people out in the field in the countries providing support. But with the travel restrictions now, we're having to provide the support remotely. So, quick example, Fiji wanted some support with some cause of death training in 3 different sites in Fiji. And SPC is providing lead support for this, with support from WHO and other partners. And we're going to be delivering this training via Zoom to the 3 different sites over 3 different days for Fiji. Other than that, we are having discussions with, if the countries have any issues, they contact our team or other teams within IMT. And we have discussions with the countries to discuss how best things can be improved for their systems. People need to be alert and cautious, but people should not panic. If people do not come in contact with the virus, there is no chance that they will be unwell. And therefore, a lot of the measures that are put into place is to try and get people to reduce their chances of becoming exposed to the virus. And so, social distancing, for example, we talk about a lot, is keeping the distance between you and others. It's because we know that the virus is spread by droplets, and so if they cough or if they speak, virus will go for about 1 meter from the person who's got it. And so if you keep your distance, your chances are much lower. If for whatever reason you get to touch someone or something with the virus, we encourage people to wash hands a lot. And I think this is one of the key messages that we give out, and a lot of people are buying into it. Any ordinary soap that you normally use, alcohol-based sanitizers are also an alternative. But you need to wash your hands for up to 40 seconds. Whilst we need to be very careful, we should not stop living, but we should still follow instructions so that we reduce the chances that we get exposed to this terrible COVID-19.